My name is Dr Mandy Johnstone. I am a Wellcome Trust Clinical Research Fellow and an Honorary Consultant Psychiatrist at the University of Edinburgh. I trained as a developmental neurobiologist many years ago at King's College, London, and I had the opportunity to get a really good foundation training in bench laboratory research, which has stood me in very, very good stead, not only through my medical school training, but especially during my psychiatry training. So what my research is really interested in is how the human brain develops, and my passion is to have a greater understanding of basic fundamental principles of how the human cerebral cortex develops. And we know, of course, that many disorders in psychiatry result from imbalances sometimes in neurons in different parts of the brain. And we have evidence, for example, that certain types of neurons in the cortex, whether it's what we would call paralbumin positive neurons or interneurons, are predominantly affected in disorders like schizophrenia. Up until now, we've never been able to model those disorders because obviously we can't get access to brain tissue whilst patients are still alive. And often one of the biggest problems of post-mortem studies is that there's also changes and artefactual changes as a result post-mortem. However, because of the improvements made in stem cell technology, it's now possible to take a small piece of skin or a blood sample and reprogram those cells to turn them back to what they were like in the embryonic stage. So really it gives us an opportunity to turn back the clock to see how that individual's brain would have developed in utero when they were, for example, in the fetal stage of development. I think many of the challenges that face us as we move forward in psychiatry are really fundamental questions about how the brain develops. And really, in order to understand many disorders which might not manifest themselves until 20s or 30s, 30 years of age, we really have to understand not only about the biochemical pathways in the brain and the pharmacology, but we also have to understand the cellular architecture. What I would say is that if you want to get involved in research, then the best way to do it is actually to approach academic psychiatrists in your area of the country, because as academic psychiatrist myself, I love to have people coming to work with me in the lab, and I welcome having that opportunity. So I think really to get yourself immersed in it and to see whether it's for you or not, it's often good to have a taste first and see if it's that particular area that you actually wish to develop. It's a really exciting time to be a psychiatrist, and it's a great time to make sure that we maximise these opportunities in neuroscience training for our psychiatric colleagues of the future.